Back in August 2009, and a close girlfriend of mine had had a bit of a scare. That night I got home and I thought I haven't really done a breast check myself for a while. Did a bit of a check and I found a lump. It was almost like my body told me that it wasn't quite right, so I sort of had a bit of a hot flush moment, I guess. So the next morning booked into my GP and went from there. So I was diagnosed with lobular carcinoma, so lobular breast cancer. Then met with my oncologist, Ross Jennings. He explained to me the process post-surgery, so what sort of treatment I would need to go through. And it was at that point that he suggested that I might be eligible for a clinical trial. But he explained the importance of clinical trials, and he explained that without them, the treatments would not improve. It might not benefit me, but it will definitely benefit generations in the future. And given I have a daughter, that was one thing that sort of made me consider the clinical trial. He did explain it in great detail and he gave me time to go away and think about it. My husband was with me at the time, so we discussed it at length, and we just decided that if there was anything that I could do or we could do as a family to improve outcomes in the future, it was worth doing. From the time of my diagnosis, I had a multidisciplinary team involved, my oncologist and the trial nurse and my breast care nurse. They were so supportive and they made it very relaxed, and it wasn't clinical. It was like they were as much a part of the trial as what you were. The trial I was on was called the TEX trial. So it was to look at whether the overall survival rates on an aromatase inhibitor were better than on the current standard of care, which was tamoxifen at the time. So once you're placed into menopause, then it was a matter of a daily drug, which was the exemestane, so a tablet every day for 5 years. You got to see your doctors every 3 months, which was, great, and the trial nurse and the breast care nurse. So you had such a good support network around you. And I could ring them at any stage if I had a concern about anything, a side effect. There were side effects, I'm sure, associated with the drug and also going into menopause straight away. They all seemed to settle down after about 18 months. When you're diagnosed, it's always in the back of your mind. There's always that little bit of doubt whether it's going, like the cancer's going to return. If you're not seeing someone all the time, you sort of start to question yourself a bit and things. And I think just having that positive reinforcement all the time really helped me get through my whole journey, not just the trial itself. Late last year, because I was finished on the trial and I was past my 5-year diagnosis, I had to say goodbye to my oncologist and the whole team in there, and it was actually probably the most emotional I think I've been throughout my whole journey, because they became such a part of my life. If there's any way we can get rid of this disease or at least make survival rates better, then that was a really important part of my decision-making process.